Welcome back, everybody.
Welcome back. Hi.
Hi.
Okay, so we're doing today, what are we doing today? We're doing the upper back pain or upper thoracic back pain. So eliminate that. And also we're going to eliminate that hump that people get in the back of here. So get rid of that hump.
Okay, I hope Quasimodo's watching.
Right? We get rid of that hump, right? So today we've got Stephanie here in a heat sandwich.
A heat sandwich.
Yeah, this is always good to start out before your self-care.
Okay.
You can do a nice heat sandwich like that. That's always good.
Okay, what do we got there? A Fomentec bag?
We got a big Fomentec bag, and it's tucked underneath the back of her neck and her upper back there, so she's getting that. And
she looks like
good.
a little Fomentec angel.
But in addition to that,
Warm heat cellophane.
we could also be heating up her triceps here like this.
Oh, wow.
So we could really get a heat sandwich here.
Mm-hmm.
And we could get a little bit on the biceps here. So if we had one more, we could put one on the biceps. So anyway, here we're giving her warm this up. This feels nice and warm, doesn't it?
Yes, it does.
It feels really good, right?
Wonderful.
And also we have Camille over here, and we put a little
hot pack.
She's got another hot pack around her neck here. So she's got one here. So we're warming up before we start.
Which one? That one? Which
So
one's that
what are
one
we doing
called?
today? Oh, this is one. This is
What's it called?
the Thermocore.
Thermocore.
Thermocore. Neck
That's
wrap,
right.
yeah.
Neck wrap. Okay,
So
good.
these are the muscles we're doing today.
Well, look, where's the pain key?
Oh, let's look at the pain key
Where's
first.
the pain key?
Okay, let's get it out.
Pain key.
Let's look at the pain key. So everybody, you could be warming up and getting ready. We're going to be doing upper back pain, upper thoracic back pain. So
Upper
this
thoracic
is,
back pain.
that's
Fabulous.
number 11. Now remember, we started with 1,
Uh-huh.
and we did the top of the head pain, we did forehead pain, we did side of the head pain, jaw pain, ear pain, eye pain, front of the neck, back of the neck. Now we're doing upper thoracic here. And so this is the most like
11 out of 60.
Yes, number 11 out of 60.
That means you're 15% of the way through the entire
Yay!
body. Woo-hoo!
Wonderful. So here's the most likely one is the scalene.
Mm-hmm.
Second most likely is the levator. The third most likely.
Wait, isn't the scalene a neck muscle on the front of the neck?
Well, it's on the side of the neck and a little
Side
bit in the
and
front.
Oh, side.
Side front.
Side
Little bit
front?
yeah.
But it causes pain in the upper thoracic spine?
Yeah, that's what it does. Yes, it does.
Gosh.
So does the levator scapula.
Oh, that makes sense.
So does the supraspinatus, one of the rotator cuff muscles.
Supraspinatus.
The supraspinatus, yeah.
You're sure about that?
We're going to look at the referred pain pattern for that one, okay?
All right.
Okay. Here's the trapezius, also causes pain there, of course.
Mm-hmm.
The multifidus, the rhomboids, the splenius cervicis, the triceps,
Nah.
and the biceps.
Nah, go on.
So we're going to test the range of motion of those, and also we're going to treat those. We're going to take a look at the pain patterns, and we're going to treat all those muscles.
Oh, what about the nerve roots? Have we...
Well, we have interesting nerve roots for this.
Okay.
So here we take a look at all the nerve roots. So here,
Okay.
the nerve roots that we're looking at are C2 through T5.
Okay.
So we're going to look and see if we have heightened tone in any of those nerve roots. And if we do, those nerve roots might be activating trigger points in that nerve's distribution. Also, we're going to be doing these tests right here.
Okay, and a lot of those I review, guys, so don't freak out.
Yes.
That's,
We've got
by
few
now,
news-
1 through 7 should be pretty...
Yeah, we've been doing them a few times.
Okay.
So that's what we're doing today. And we've got, so looking at all those things. So we're going to start with self-care. And so sometimes, okay, we could look at the test too. Yeah, we could do that in a minute. We'll do that in a minute. But
Okay.
here's all our tests that we're doing today.
Yep.
So here's our test, and then we're going to come up here and we're going to be doing, so here we'll be doing also test 14. This is so we did before, hand to the shoulder blade. We did that last time.
Right.
We're also going to be doing 15, which is the arm abduction. We've been doing that. Also, we're going to be doing 17, 18, and 19. So 17 is for the arm pull back, which we did last time.
Okay.
And then we're doing this one, the overhead reach, and the overhead reach and the over shoulder reach.
Yeah,
So these are for the triceps.
Yeah, one is a 2-arm together.
And
the
one
other
is
just
one
a
at a
single.
time. Yeah. So those are the ones we're doing today. And another one we're doing today is the scaling finger flexion test. We'll be doing that today. So those are fun.
Okay, great.
So before, so all of us, if we can do our the range of motion tests together, we can do that.
Should we look at pain patterns first?
Oh, let's do it first. Let's look at the pain patterns first.
Because
Let's
by now you guys should remember there are 3 prongs to diagnosing trigger point or myofascial dysfunction, and that is the pain pattern, the range of motion test, and palpation. Pain pattern, range of motion, palpation.
Okay.
Let's take a look at the pain patterns.
Let's take a look here. We've got a great one here. This is the scalenes.
Okay.
And you see the scalenes are on the side of the neck, and they attach onto your first rib and your second rib here, or second ribs. But look, it causes pain in the upper thoracic area right here.
Wow.
That's the area. But in addition, look at all the pain it causes down the arm.
That's crazy.
That's a significant one. Also, the next one we're going to take a look at here is the supraspinatus here. So this one causes pain here in the upper thoracic area, and over here it also causes tennis elbow.
Supraspinatus causes tennis elbow?
That's right. Imagine that.
Oh. Wow.
Incredible, right? We're also be treating the biceps, and it causes pain here. The main pain it has is here in the front of the shoulder and here in the crook of the elbow.
Sure.
But in addition to that, it causes pain right here in the upper thoracic area, the biceps.
Wow.
Is that incredible?
Yeah.
It is incredible.
How do we get problems with our biceps?
Well, sometimes it's from. Let's demonstrate. This is like a lot of us have probably been feeling this from using our cell phones.
Oh yeah.
Our arms are so, and then we're doing like this and we're talking.
Oh my gosh.
We got our hands in this bent position all the time, so it's shortening the biceps all the time. Then we're up here. Look at how we're really shortening it, and then the part of the triceps that causes the upper thoracic pain here is the one that you use to bring your elbows in here, like for a golfer's elbow, kind of. Golfers might use it too. But also when we're using small computers, we're bringing in the elbows like that, and we're working like this. So our everyday life, including computers, and our telephones, are what really shortens up our biceps and causes trouble with our triceps. Oh, he's going to check it. Okay, we're going to check it.
Okay.
Okay, so let's take a look at the triceps. So here, the long head of the triceps here, this long head, it causes pain also in this upper thoracic area here. So I highlighted it for us to look at. So here's this is this part of the triceps right here, and it kind of brings your arm close to your body. That's that part of the triceps. And also, the triceps causes a lot of other pains, but this is the one we're concerned about here today, is the upper thoracic area. And let's see, so we looked at the biceps, we looked at the triceps, we looked at the supraspinatus. Let's see, we missed a couple. We have a couple more to do. Okay, they're here in the front. We're also going to be looking at the levator scapula. And you can see it attaches here on the C1, 2, 3, 4, on the outer edge of the vertebrae, and then attaches on the superior angle of the scapula. And you can see it causes pretty good pain in the upper back. And let's take a look at another one of them we're going to look at today. And this is our splenius cervicis. Remember, this one causes that pain in the eye right here, really bad eye pain, and it also causes upper back pain right here, upper thoracic back pain right there. So today we're mostly concerned with this. You see here it attaches here, and it attaches onto the transverse processes and onto the spinous processes right there. Okay, so and then we have one more referred pain pattern to look at, and that's our trapezius. And you can see that it causes a pain like this, that question mark pain, but in addition to that, trigger points 2 cause pain in the upper thoracic area. Trigger points 3 causes pain, which is down here, causes really bad pain throughout the upper thoracic area. And trigger point 4.
Can you speak louder? They say.
Oh, trigger point 4 causes trigger. Tell me if that's louder.
You got some hearts, and speak louder.
Okay, good. So here's just the trapezius as is going over the infraspinatus, causes pain in between the shoulder blade there and of the trigger point 5 right in the
Right Let us
And
know.
have one more. We'll take a look at the multifities. So today we'll be thinking about the multifities, and we're going to be thinking about the multifities like C2 to T5. So we're coming all the way through here. And you
Yes,
can see,
I can. No, not really. Okay, so not everybody can see clear and some can.
So here's it attaches here in the spinous and there, and it causes pain throughout the back. And let's see if we can nice preferred pain pattern for it. So it causes pain throughout the whole. At each level, it causes pain right there. So that's our multipity. So we went over the referred pain patterns for everybody.
Yep.
Super. Okay, so next we're gonna. So those of us who've been heating, we're gonna start to treat some of our neck muscles. So let's go ahead. Let's unpack you. Now she had 20 minutes of sitting on the hot water bottles.
Thank you.
Now we're gonna take you off. Okay, go roll to one side and then go ahead and sit up.
There we go.
Great, super. So we're going to start out with some tools. We're going to treat the scalenes.
Scalenes. Have we done scalenes before?
Well, we did do the scalenes.
Yes, we did once.
But it was when we were doing the ears.
Oh yes, for the ears. That's
Because
right.
it helps to drain the ears. So it helps to do that. Okay, so we're going to do a little bit of range of motion testing, and then we're going to go do a little self-care. Okay, so everybody, if you could learn all the range of motion tests,
Okay.
that'd be great. Okay, so we're going to do, everyone, last time we used the goniometer, last time we used the goniometer, this time we're going to just use the measuring tape. Okay?
Okay.
Okay, so our first one we're going to do is rotation. So let's go ahead and have you rotate. So turn your head all the way to the right. And that's pretty good. So we're trying to get your nose to the acromion. So that's very good. So that looks good. And we're going to go ahead and do it this way. And she's getting her nose to the acromion. So that's a pass.
That's
so
a pass.
How about the rest of you? How are you doing?
Everybody passing? Cervical rotation, folks. It's not brain surgery. I'm just kidding.
Okay. So we're going to do lateral flexion, and here we're going to go from the earlobe to the shoulder. We'll see how close we can get. So we're getting, whoa, that's very close. This is really perfect. So this is 2 fingers. Let's do it on the other side.
Okay.
So we're going to go ahead. 2
Ooh,
fingers.
wow,
That's very
great.
good. Excellent.
Yes, good.
So that's good. So a goal could be to even get down to no fingers, but that's quite good, down to 2 fingers. Then we're going to do chin to the chest, and we're going to see if can we get. So here, let's get this underneath here. So this would be like 1 finger, I'd say. So we could get it just a hair better than that today.
Okay.
So we got 1 finger, and then we're going to do extension. So we get your nose up to the ceiling. Excellent, pass. That's good. So she did that really well. Now the next thing we're going to do is a test for the scalenes. So this is called the scalene finger flexion test. So we're going to go ahead and you can go. What you want to do is be able to bend all the joints and still get this back. So that's the one way of doing it. Let's put it over here
Yeah, it's good
on the wall.
Yep, good to have it back up against the wall, right?
Yeah. Oh, I think why don't you film from over here,
Yeah.
Kristen, and then you have to come this way. Let's give me one hand or the other. Okay. So we're going to get all the interphalangeal joints to bend, and but you want to get your knuckles back, and now the show us a fail. If the scalenes were being compressed, then you'd see your fingers would stick out like this. So if the scalene muscle right here were pulling up on the first and second rib and pressing the brachial plexus between the collarbone and the rib, then you would see the fingers stick out like that.
Okay, so and that has to do with the nerve compression in the
That's right.
brachial plexus?
Right, so it's heightened tone. So whenever the nerves are compressed slightly, they cause heightened tone. If they get completely compressed, then you have lack of tone. But when they're slightly compressed, they cause heightened tone. So that's what we as myofascial trigger point therapy are really concerned with.
And you could have trigger points in the
That's fine.
scalenes
I know.
without that.
Correct.
So
Because if the scale, you could have trigger points in the scalenes, and if it wasn't adequately short, it wouldn't compress the brachial plexus.
Right.
Yeah. Okay, let's go ahead and let's take a look on this side, and you'll see here that she's passing the test. So you see all these fingers are passing the test.
Show us the fail again.
That would be like a fail.
Yeah. And sometimes you can get a couple fingers. Show us just the fail with the last two here. Yeah.
Now, if 1 finger is sticking out, it's not a brachial plexus dysfunction. it's actually a dysfunction of the muscles that go to this finger, like the flexors and extensors that go to this finger.
Yeah,
Okay.
great.
Or maybe the interossei. So this would be, so let's take a look at yours.
Mine aren't the best.
Come here, we're going to take a look at Camille's. So you got to get your knuckles right onto the, okay, so go ahead and bend. Okay, so you can see that you're pretty good, just a little bit of dysfunction, so
Little
it's
bit.
not too bad. Yeah, so this is pretty good. So I think she could be a therapist then. She's good enough. Yeah, let's try that side. Yep, you got to keep the knuckles all the way back. Okay, here. So on this
Oh,
side.
I didn't have them all the way back.
Oh, you didn't. Okay,
That's-
there you go. Okay, there you have some dysfunction.
Yeah.
So here you see. So
That's
now it shows that you have some brachial plexus dysfunction. So what this is showing is that the scalene here that goes to the first rib, and this one that here goes to these two that go to here to the first rib are pulling up on the first rib and pulling it up against the collarbone and causing heightened tone. So we'll have to take a look at that.
Okay.
I have a nice picture of that. We'll look at that later. Okay. All right.
That's it.
Okay. Next, let's take a look at some of our other tests. We're going to take a look at the. Let's look at what's the next number that we're supposed to do. Let's see. Okay, so we're going to do this 12, 14, 15, 17, 18, 19. Okay, so let's take a look at 12. So let's look at 12. So 12 here would be the back rub test, which she can do really well. And then this is of course as a pass. So you want to be able to get your middle finger to the superior angle of the scapula. So that's like within one finger of that. So that's good. Let's try it on the
Wow.
other side. Let's get it up there.
Wow, look at that.
So that's perfect on this side. So the right side, let's do that again. So let's get the right side just as good as the left.
So it's,
Well,
it's a middle finger to the,
The middle-
upper angle of the scapula?
you want to get to the spine of the scapula.
Spine of the scapula.
Because that's what you can reach. It's hard to reach the superior angle.
Ah, okay.
So you get to the spine of the scapula right
Okay,
there. Yeah.
okay, great.
So that's a pass on both sides. Okay.
I have a
Amazing.
fail on both sides.
Camille, you want to show us? What was Camille got?
Oh, Camille. Okay, so this is how you measure. So those of you that say you're going to go to the spine of the scapula, you're going to measure down to the middle finger. So find the spine, and you're going to measure down to the middle finger. So that's minus 7.5 inches. So we'll see after we treat if it's a little bit better. Go ahead and try the other side. So here, so find the spine of the scapula. So here you feel the spine. So this is the spine, the bony part that sticks out right there. Come to the middle section there, to the middle finger, and 5 inches on this side. So 7 on the one side and 5 on the other. Yeah.
Yeah.
Okay. We looked at that. So let's also look at the next one. Let's look at 15. So for this, we're going to do the arm abduction. So we're going to do this with a little bit of resistance. So this is to look at the top part of the trapezius and its dysfunction right here. So, oh, this is feeling better.
So this is a little bit of a strength test too.
Okay, so we're going to go ahead and have your thumb down. Let's go ahead and resist and go up. Push, 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 push. Good. And let's do it the same thing. We're going to have the thumb and go up. Good.
So the patient is pushing
you-
up while Sharon's
And-
providing
and you
resistance.
Shouldn't feel any pain when we're doing that.
Yeah.
no
So a
pain.
fail would be any kind of a pain
Right,
while
right.
she's doing that.
Right, so we'll start with the thumb up first. We'll go up, give her just a little bit of resistance.
Mhm.
Very good, and she's not substituting anything.
Right.
And again, let's do the elbow, the little finger, the thumb down, and little finger.
And
side
one
up.
way to measure
Oh, here.
pain when you're
A little
doing
bit dysfunctional there. So I had my hand on it right here, and I could feel that when she got up to about go up again, there she goes. She starts to get dysfunction in the trapezius right here.
Okay, so you felt a little bit of weakness.
Yeah.
And Stephanie, did you feel any pain at that
She
point?
felt it too.
I do.
She
Okay.
felt it. So your trapezius on this side. So we'll see if we can improve that by
Yeah.
working what we're doing.
Yeah. When the thumb is down, it's more upper trap, and when the thumb is up, it's more deltoid.
Yeah.
So
But we had with the thumb down.
it was thumb down right about there.
Yeah,
We
right
started to get some weakness
Yeah,
and
you're right
pain.
there. Yeah.
Okay,
So a
good.
combination.
Good.
Okay, so
good.
next we're going to take a look at the arm pull back for our biceps. So let's go ahead, and all of you could sit down in a chair, and then we're going to take a look at can we get the biceps. So this is something to use that you all can get from the Relax Your Back store or somewhere on the internet. So you could get put your butt back. So get your butt back. Yeah. So you want to have. So this is going to help her have her head in the right position. Okay.
Okay.
Here we're going to go. We're going to take the arm back, And so here we have a little bit of dysfunction here. So this is your biceps. So you can see it's a little, you can feel it?
Yes.
Yeah. Okay, so let's try it on the other side. Okay, this is a little bit better, but see if we can get a little bit
So
better.
what's
on both
normal?
sides. If we can get it back to where the spine is, or just kind of in line with the shoulder, straight back. It shouldn't be. It's like here. You see, it's
You see?
kind of at an angle.
Right, and it
So
should be almost
it should
back
be
to the
straight,
spine.
straight back,
Straight back. Okay.
straight back. It should go straight back easily. And this one too should go straight back.
So that one's better. But
it's
not
better,
quite.
but it's still at an angle here.
Mhm.
Yeah. So you would like to get the biceps back a little further, and no restriction. Arm reaches straight back in line with the opposite shoulder. So we can get it. Restriction: arm does not reach straight back for anterior deltoid. So in other words, you're looking to get it to come straight back. And it's nice if you can get it to come all the way back to the spine as well. You know. So.
Okay.
But it's still pretty good. Okay, so let's have you go ahead and clap over your head. We'll do that one. Okay, here, you're looking. Can you get both arms up, and can you get them close to your head there? And that's that triceps that causes the pain up into the shoulders. So is that one? So she's passing that one really well.
And her fingers line up right there,
Very well.
which is good.
Yeah. Let's have you do it standing up. Let's try it again, standing up. And one more time.
Can you show us what a fail would look like?
Yeah, so this would be a fail. So
Yeah.
let's bend this arm, like you should come up, and this arm would be there, and that one would be there, or both arms wouldn't come up to get
Right.
to. She wouldn't be able to get them towards her ears. Yeah.
Right.
And also you're trying to get the arms a little, so the triceps a little tight because you're not getting it behind your ear. Okay, the next is you're going to come like this, and you're going to bring it back. Oh, that's a pass. Good. So that's very good.
So that should be elbow straight up to the ceiling.
And you should be able to get it behind your
And what
ear.
are we doing with the hand here?
We're putting the hand on the shoulder, so we're taking
Okay.
the hand. So we're starting here, we're just putting the hand on the shoulder,
Great.
and then we're taking the elbow back. Like that.
Perfect.
And let's go ahead on the other side. Put your hand here, and then you're going to take the elbow back. Yeah.
All
So
right.
she's doing that really well. Let's try that
Good.
one more time. The other side, this side wasn't quite as good. Okay, so, oh, she's doing it good now. All right.
Is this
If you
a
keep
pass?
doing it, okay,
Is it?
so let's take a look at Camille.
I think this is this one.
Okay, so watch here. So here,
Keep your head straight
so
forward. There you go.
your elbow should be a little going further back.
Okay.
Yeah, so you should be getting it behind your ear.
But not too bad.
Yeah, pretty good, pretty good.
Yeah, that,
Yeah, well, all
Well,
right.
not everybody. Okay, so let's take a look at treating ourselves. Okay, so we're going to take a look at treating the scalenes.
Is everybody ready for self-care?
So we're going to use this tool here to treat our scalenes. You could get one of these, okay? Okay, great. So we're going to use this tool and we're going to treat our scalenes. So we're going to look at where so they attach right here at like the second vertebrae. So on the side of the neck, and we're going to press straight in like this. We're going to go like this and press straight into the side of the neck.
Can't see where we're. Let's see here. There we go. Okay.
Right like that, yeah.
Where are you in relationship to the
This is the-
transverse process of the vertebra?
We're right on the transverse. So here we
Okay.
are on the transverse. This is where it attaches right on the transverse vertebrae.
Okay.
The transverse process of the vertebrae, right on it.
Great.
there.
Okay.
And right over it like
And that's
that.
for the posterior scalene?
This is we're on the middle.
The middle.
Okay.
Okay.
So let's go ahead and I'll do it with you.
Okay.
So so here we are. Okay, so here we started out right on the middle, on the middle scalene right there.
Mm-hmm.
And to get a little bit more pointy, you might want to use a little more smaller.
yeah.
That's what she
Something like that.
wanted. She's like, this is not pointy enough.
Okay, less pointy. Okay. So next we're going to go a little bit more anterior. So first we went straight down the side here to the rib. Now we're going to go a little bit more anterior into the rib right there.
Just a little bit behind the SCM?
Yeah. So here's the SCM.
Yep.
Okay. So go ahead and grab that. So just behind it, right there,
Uh-huh.
that's the anterior scalene.
Great.
So let's go ahead and right where so if we pinched it, right where your thumb is, that would be the anterior scalene. So let's go ahead and attaches onto the transverse processes right there.
Mm-hmm.
And what do you think of the painfulness of that?
I can feel it.
She notices it. Okay. And we're going to come down like this all the way to where the rib is. Okay, so we did the anterior and then the middle, but now we're going to take a look at the posterior. So how do we find the posterior? So we find the trapezius. See, here's the trapezius. You can see how it's sticking up there. And that's the trapezius coming here to the base of the skull right there. So that's the trapezius. So it's just anterior to the trapezius right there. So this would be attaching onto the second rib.
So it's the posterior.
This is the posterior scalene. It's less likely to be pressing on the, causing nerve compression.
Sure.
The anterior and the middle one are the likely ones to cause brachial plexus compression. But what if we had long thoracic nerve compression? Then it would be between. Then it would be between the. Then this would be. So if you had. So we'll review this, especially if we're doing next week's.
Okay.
Okay. So that'll be next week.
Oh,
Okay.
good.
We'll do long thoracic nerve next week.
Okay, all right.
All right. Go ahead. Let's have you do the other side. Okay. So let's see if you can find the middle scalene first. So I'm going to pull out a nice picture of the middle scalene here.
Now, she didn't fail many scaling range of motion tests, right?
No, she didn't.
So, but that's why you have the three-part assessment, because you can still have palpation come up positive.
So here is a picture of the scalenes, and you can see they're attaching onto the anterior one is a little bit more forward, and the posterior one's a little more posterior onto the vertebrae there, and then you can see it's attaching onto the first and second rib.
All right.
So the pain pattern of this is all over the shoulder, between the shoulder blades, the chest, down the arm, and all the way down into the hand.
Yeah, it has an interesting pain pattern right here. Sorry.
Oh yeah, it's one of its main pain patterns is right here,
Right over
right
the
there,
rhomboids, right there.
right there. That's one of its main chronic pain patterns.
And you
so,
can.
how about someone often says, I keep treating this rhomboids, but I keep treating here in the upper back, but my pain never goes away.
Yes.
A lot of times it's from the scalenes that Stephanie's pressing on right now.
So important.
So now we're getting a little bit posterior there. So we're gonna get you want to get a little bit more anterior for your scalene, right there.
Do we have the scalens up here?
It's up there. It's right here. This is it. That's your scalene.
Okay.
So here's the scalene pain pattern, and you can see that it's in the front of the chest, the front of the arm. But this is so if it was bothering you only in one place, it would bother you right here in the upper thoracic and between the shoulder blades. Okay.
Yeah.
But then if it was worse, you'd start to feel it. And then as it got worse, you begin to feel it down into the
I
hand.
think everybody must have felt this at some point. There's those spiky, achy feeling in your chest that won't go away, and then your rhomboids on your shoulder blade, and then it starts to go down your arm. That's the scalenes right there.
Yes, and it could be what's causing thoracic outlet syndrome, carpal tunnel syndrome,
Yeah.
many different regional pain syndrome. It's one of the key things in fibromyalgia, a lot of different referred pain syndromes.
Yeah.
So how's that feel so far? Okay, good. Okay, so after we've been pressing on it and working on it both sides, we're going to now take it through range of motion. So we're going to stretch it, and we're going to take it through range of motion with a little bit of variation. And so we can go ahead, and also we could do it with a little bit of resistance. So you could put one hand on your head. Oh, you got rid of your tool. You can give yourself a little resistance, push to the right, push your head to the right, but not too much resistance. Keep moving. Not so much resistance that you can't move. Yeah. So just a little bit of resistance. I'll do it for you on this side. So go ahead and move. So just the amount of resistance you can have and still move. Okay? Keep moving. Push harder, push harder, push harder. Okay? Okay, this side. Okay, push. The other way. Okay, keep pushing, keep pushing, keep pushing. Okay, keep pushing, keep pushing. Yeah, good. Great. Yeah, push the other way.
What does the adding resistance do?
So so one thing we want to do is make sure that the muscle has full shortening, and we got to have full lengthening. So by doing this, we're activating the part. So we're seeing, does it have full ability to shorten? So and we're encouraging the shortening.
Yeah, and you're getting every little myotactic unit
Yes.
to learn to fire again. Because remember, one of the big things that happens with trigger points is after a trigger point's been there for a while, the individual myotactic units, they stop firing. So a lot of, Sharon, would you say a lot of muscle weakness is actually just inhibition from trigger points being
Totally.
there?
Okay, totally.
Yeah.
So I'd say the first thing to look for when you have a weak muscle is it inhibited?
Yes.
Because what could happen if you strengthen a weak muscle, everything could strengthen but the weak muscle because it's inhibited.
Mm-hmm.
So then all the other muscles learn to do that muscle's job,
Yeah.
and that muscle learns to do nothing.
Yeah.
Yeah. So by treating it first and getting it to activate and really be able to contract and stretch, you're then getting it to really you're really getting it to do its
Yeah.
job.
So after she's compressed and she's released, she's gotten the myotactic units to fire again, then she's giving them some resistance to practice.
Now here is the brachial plexus, the nerves that are coming out of C5, 6, 7, 8, and T1.
Mm-hmm.
And here they're coming down through here, and they're getting pressed by the collarbone that's right there against that nerve bundle. But we also have blood supply and lymphatic that also can be compressed here.
Oh, yeah.
And you can, sometimes you'll see from the scalenes, you'll have a swollen back of the hand.
Oh, yeah.
So that it'd be swollen right here.
Mm-hmm.
And also another thing we could test is we could see if you have good blood supply, down into the hand. And then you could treat the scalenes and the pecs, and then check to see if you've got good blood supply again. So that would be another great test. We'll do that again. We did that once before. We'll do it again. Okay, so we did the scalenes. Let's take a look at the levator scapula.
So, in case you guys weren't figuring out, she was just emphasizing scalenes for a reason. It's just, scalenes is just one of those major home run muscles.
Well, it's a key muscle. Thanks for mentioning that.
Yes.
It's a key muscle, so you can see that in actuality, the scalenes could activate the trapezius, the rhomboids, the triceps, the biceps, the pecs, the flexors, the extensors, the interossei, the finger muscles. So it could activate all these other muscles. So it's key in rotator cuff, hand pain, shoulder pain, head pain. So it's a key muscle in so many other
And it's
syndromes.
frequently dysfunctional because of modern living.
Oh, now what's a really important underlying perpetuating factor in this muscle?
Being alive.
That's it. Okay, paradoxical breathing.
Oh, right.
Yeah,
Paradoxical
so
breathing.
we'll go over
Okay.
paradoxical breathing in a couple minutes.
Okay.
So that's we're going to do that. So next we're going to do levator scapula. So if we could use our back knobber for that today.
Sharon is never more than a couple feet away from a back
That's
knobber.
right. You can't be too far away from a back knobber. That's right. You got to have your back knobber. Yeah, and this is one that both of us like. We like this one. Okay, so for this one, you want to feel the scapula, the shoulder blade. You're going to get right on the top of it, and you're going to press there, and then you're going to come up and you're going to go. So just go ahead and press right there, right there. So go ahead and breathe and relax. So that's your levator scapula.
That's at the superior angle of the scapula.
That's
there?
right. It attaches right onto the superior angle of the scapula. And here it is right here. So you take a nice picture of that. Okay, so we're going to go ahead and treat that. So we're going to press right onto it right here.
Let's see, 1, 2, 3, and 4.
That's
Those
right.
are the.
And it's going to go to the transverse processes here.
Mhm.
Right there, yep. And then come on up. Now you're looking for the painful spots. It's not painful, you can move on to the next spot. If it's painful, we can go back there 2 or 3 more times and press right on it. And breathe and relax. And then we're going to come up a little higher, and we're going to come right to the where it attaches to the side of the neck, on the side of the vertebrae or the transverse processes right there. Now, one way that I like to, this is one of the ones that could really cause what we call Frankenneck.
Frankenneck.
So we're going to get right on it. So we're going to really shorten it
Yes.
and really lengthen it. We'll get right on it. We'll get right into it here. We're really going to shorten it and really lengthen it. We'll get right on it here. I'll really shorten it and lengthen it and get right on it here.
You can tilt.
And also, you could come here and you could bring the shoulder up. Just the shoulder, not the elbow. Yeah. And then so go ahead and get that up and really make it contract and really stretch. So then you could go like this and really contract it, and then take it apart and really stretch it. And keep pressing. And really contract it and really stretch it. So that's really good. Let's go ahead and go on the other side.
Okay, fabulous.
I'll do it with you. So let's go ahead and let's feel the attachment on the top part of the shoulder blade. So we're going to press right into it. And let's stretch it a little bit to the opposite side. And let's go ahead and keep coming up, looking for painful spots.
Steph, if you see how Sharon's holding it, she's able to get at more of a side angle so that it's not in the way for her to do the stretching and compression. Yeah, exactly. There you go. Great.
Okay, that's our levator. And I guess it's a nice paint pattern there. So let's, after the levator, let's go ahead and
let's see the paint pattern.
Oh, there it is. Yeah, right
yeah.
there. So it comes all over the shoulder. And it's one of those ones that calls Franken neck.
That's that crook in the neck. You wake up in the morning, you didn't do anything but sleep, and all of a sudden you can't turn your head side to side.
Okay, next we're going to take a look at the supraspinatus right here. So it attaches out here onto the humerus, and then it comes over here and attaches in the top part of the shoulder blade. It's a rotator cuff muscle, but if you take a look here, it also causes pain into the upper back right here. So this is your upper back area. So that's our supraspinatus. So let's go ahead, and so we're going to find the spine of the scapula. So you just find this like bony part right there.
Yeah.
They're going to get right on top of the bony part. They go right onto it, right there.
Yep.
And you also want to come right out here to where it attaches. So right where it attaches over here, you want to get right there and press right on that spot, right there. And then we want to get over this bony part right here, called the spine of the scapula. And we're going to get right onto it, right there. What do you think? Oh, we found a spot. How's it feel on you, Camille? So you want to feel the spine, and you want to. So you're going to feel it. So you want to one spot. You want to get right here, get over the acromion, and then get right here. So you want to be right there. So you find the spine, come just above it, right there. So find the spine, feel it, come just above it, right there. So find the spine, come just above it, right there. Yeah. What do you think of that spot?
Don't like it.
Well, she doesn't like it. She doesn't like it.
I don't like
This is one of the three main muscles that lifts your arm straight out like abduction.
Yes. And it's a rotator cuff muscle.
Yeah.
And it causes tennis elbow.
Yeah,
It's
yeah,
referred
yeah.
pain to
Let's
tennis
take a look
elbow.
at that again.
elbow injury from last year.
Tennis elbow right there.
Good. Let's take a look at the other side. Then we'll give it a nice. Then we'll give it a nice range of motion. So here we're going to find. Let's go the outside of the shoulder blade right there, or the outside of the shoulder right there. So it attaches right there. So find the bony collar, the acromion right there. Go right here for your attachment point. And then let's come right over this. So find the spine of the scapula. Come right above it. Right there. Yeah, right there. How's that feel? Find the spine. Come right above it. She notices that. Okay, let's come right, find the spine, come right above it. Yep, right there. So for all of you therapists, you can get 2 continuing education units by watching the show today, and of course all the shows. So we have 48 shows, so that'd be 48 times 2. You can get by watching all our programs.
Yeah, nice.
Okay, keep coming more immediately. So feel the spine. So again, you know you're right on it. If you feel the spine and then come right above it, you know you're right on that supraspinatus.
Yeah. We know you work hard enough. you don't need to pay for your continuing education. We're happy to give you the units just for showing up and doing all the work.
Great. Okay, so now we're going to stretch them a little bit. Take them through range of motion.
Wow, how do you do range of motion for
So
the
for this one here, you're going to
supraspinatus?
go like this, and then you're going to take it out like that. You contract it, and then you're going to stretch it, and then you're going to contract it, and then you're going to stretch it, and contract it, and stretch it, and contract. Let's do the other side. Let's contract it, and stretch it, contract, and stretch, and contract, and stretch, and contract, and stretch. Good. So
Right.
that's our infra. Okay, good.
Or supraspinatus.
Oh, supra. Not the, we did infra last time.
Yeah.
This time it's supra.
Yeah, supra.
Supra, supra. Okay, so our next muscle we're going to be doing is the trapezius. Okay, this is an important one. So it causes, you saw how it caused so much pain in the shoulder. So here's our trapezius muscle. So here we're going to take a look at the trigger points in the thoracic area and lower into the mid thoracic. So we're going to treat the trigger points in the upper thoracic and the mid thoracic. The reason is because this lower trapezius area refers all through the entire thoracic area. So let's start with that today. Let's start with this lower one right here. So
Okay.
look at how trapezius comes down to the T12
Mm-hmm.
and attaches up here to the base of the skull.
Mm-hmm.
So let's go ahead and see if we can put this little section on the stretch and treat that little area.
Anybody know how you would stretch that part of the trapezius? Anyone think of how?
So we could take our tool here, we could hunch over like this, and we could come in and treat the trapezius right in there. So we do our best to get this lower section here. So we could go ahead and give it a good stretch.
Ah,
Like
okay.
this. Give it a nice stretch. So look at this lower section. But remember, this lower section is the most likely spot to give us that balls of pain in the back of the head and pain throughout the top of the shoulder. And so this is very common to have this being a problem for us, this section right here. What do you think of this section here? Does that, you feel it going up at all?
Yeah.
Camille, let's see you do it on the stretch.
I'm trying to. This one doesn't work as easy as the
Yeah, go
smaller
ahead,
ball.
try this one here.
Yeah.
Did you like the metal one sometimes?
Sometimes. Yeah.
Sometimes she likes it.
All
Okay.
right,
Yeah,
so
that
you-
one I couldn't reach.
So you flex forward and then you rotate toward
So
the
if you
opposite
could,
side.
yeah. So if I was treating somebody else, then I might go ahead and give me the. So I'm going to stretch you like here. So if I was going to stretch her,
Mm-hmm.
I could go head forward. Okay, and give me this arm. Okay, so here, and to that side. So here
Okay, look at that.
we're giving a nice stretch on the and treating the lower trapezius.
That's beautiful.
What do you notice about that?
A little sore.
Yeah, so this area here, so I can see, so we have a few taut, if I can feel some taut bands right there.
That's beautiful. You see that positioning, everybody? That is really, really important.
Right here. So this, again, causes this to be active right here.
Sometimes it's that little bit of stretch that makes the difference whether a trigger point will release or not.
So we'll have our head forward,
Mm-hmm.
take our arm to the other side, we're going to get the trapezius right here,
Mm-hmm.
and we put it in a nice stretch. So when we press, then we can see, sometimes when we press, then you can see, does it increase the stretch when I do the pressing?
Yeah.
So you're seeing,
So as she's
so here we got some nice taut bands right here. And right there, I guess it really
we,
can
we,
look
we
right
can
there.
see them on camera.
Okay, so for this, let's give you a big stretch here. So we're gonna do the midsection. So turn this way. Okay, so this section, I got some really good taut bands here, Justin.
Okay, all right.
Okay, so she's gonna give herself a big hug.
30
So-
years and she's still excited when she finds a taut band.
What can you say? Right there. So you felt that one, yeah. And remember, these cause trouble throughout the whole region.
Mm-hmm. So in addition
So
to
right here, right here. I feel it right there.
In addition to trigger point therapy, you could take some judo moves. That's always good for learning how to put a muscle on a stretch.
Okay, so let's have you do this side. Okay, so see if you can put it on a good stretch the same way. It's easier if I do it, but
Right, it's interesting to do this on your own.
so you try to go ahead and hunch and stretch at the same time. Yeah, yeah. Give yourself and have your head go like that. Yeah, so that gives a good stretch there. We want to get these fibers that go across here, and these fibers that go up.
Would seated maybe be easier for
Seated
this?
is very good too. So
Yeah.
let's try it seated too. Let's go ahead and let's have Stephanie. You could sit do a little seated.
Yeah.
So then we anchor. We can anchor the.
Yeah.
That would be a good way. Yeah, I like how you're doing that, Stephanie. You can come up through this region here. So look for some taut bands. So go ahead. Right there. You can feel them right there.
You can see them. Okay, we got hearts for that one. Good. Way to go, Steph. They sympathize with you. Great.
And keep coming up. Okay, let's try it on the other side. Okay, go ahead. And you're gonna go ahead and give it a good rounding. Yeah, I found some tight spots there. I feel them. I feel them.
You got some more hearts of sympathy. What's Camille doing here?
Found a lot on the other side. Now I'm finding some on this side.
Now you're doing some just movement, the basic stroke of movement over the point, just loosen it up. Because then also that's one type of stroke, but also of course we oftentimes use compression with 2 full breaths, right, Sharon?
Right.
Yeah, exactly.
Breathing and relaxing as we're doing the pressure.
Yeah. The movement stroke feels really good, and it's good to loosen up in the beginning or sometimes afterward, but that full-on compression is really...
We want to go deep to the bone.
Yes.
So we're trying to go to the bone, the fascia. We're trying to really get in there deep. Yeah. Okay, let's do a little bit of movement with that. So let's go ahead. We're going to do some of its actions. So let's do a few actions of the trapezius. So you have to push that back. Yeah. And we're going to do some movement. Let's see. Do this one. Okay, so for this, we're going to have one of our main things is it brings her shoulders up and brings her shoulders down. So let's use the back. So let's go down and back. Down. We go forward. Stretch it. Back and contract. Forward. So bring the thumbs all the way in. Bring the thumbs all the way out. Let's do one side at a time. In and out. In and out. Other side. In and out. In, out. Good. Now let's ear to your shoulder. Middle. Ear to your shoulder. Middle. Ear towards your shoulder. Middle. Ear. Middle. Ear. Okay, let's bring our ear to our shoulder this way and then stretch them apart. Ear to our shoulder. Stretch them apart. Ear to our shoulder. Stretch them apart. Great. Okay, good. Good. Okay, next after our trapezius, we're going to take a look at our multifidus. Now, for this, we're going to take a look at the again, as we've done before, we're going to look at, can we get the skin to come up? So here we're going to be looking, and then we're going to treat the multifidus where it's tight. So here we're a little bit tight here. So we'll check this. So here we're not tight. Here we're not tight, but here we are. So we're going to treat the multifidus right here. Here
So
we're not
the
tight.
multifidus assessment is the same as the supersensitive spinal segment assessment?
Well, pretty much. But we could also, the multifidus, also are active in when we did the neck flexion, rotation,
Yes.
and extension. So
some of the
it's a
range
good
of
test.
motion.
Yeah. So the other range of motion tests work for them too. But also we're going to treat the multipities
Uh-huh.
where you have the supersensitive spinal segment. Yeah. So here, so we have C5, C6, T1. Okay. So here, so all the way from here to here, we want to treat on you. So from here to here. So let's have you treat it. So you're going to treat. So you can use your tool here and get right on it. So you're going to go ahead. So you're going to find the spine, come just to the side where the multipities are, and press right in, right like there. So let's take a look at you. Okay, so here you can see here she has that head forward position, and she's getting a little bit too much of this sticking out here. So but let's see here. So we're too tight here, too tight, too tight, too tight, too tight, too tight, too tight, too tight. Okay, the whole thing. So here, what you want to do is start here at C2. You're going to go find the spine here, and you go just to the lateral to it, and you're going to press right in here. And let's see if we can get this to be a little looser, okay?
Mm-hmm.
So come on through here, all the way through here, like that. And then we'll do some head balancing, see if we can get that hump out of there. Okay, great.
Can I say something about multipity?
Yes, would you?
There are, the muscles that are segmental are so important because the neck is made, of course, 7 different individual vertebrae, and each one of those vertebrae needs to move independently but coordinated with the others. There's interesting, you can see in Stephanie's neck, for example, there's a bit of a cervical, there's a reversal of the lordosis, the normal curve here, and that means that probably the little tiny muscles that move individual segments up here are working, and here are not working, and here maybe, but in here where there's, it started to, the normal curvature is not being maintained, you can bet that some of the tiny little segmental muscles like multifidi are not working. So it's never overlook the importance of a tiny little muscle, just one little multifidi that's going from the lamina of one, or a transverse process of one segment to the next. That could be the whole reason that the neck doesn't have a normal curve to it. So.
There, she notices that spot.
Yeah, that spot is
that
definitely gonna. I can see it.
We could see that spot.
Yeah, yeah.
So right there.
Yeah.
So here's the multifidi.
Yep.
So let's take a look at that side. So this is the muscle. She's working on the other side, but we're about right here.
Yep.
About right here, and it's probably pulling and not allowing the vertebrae to go forward.
Yeah.
So
not
if we
allowing
start
it to extend into that normal curve.
Yeah.
Yeah.
Or for either direction exactly,
Yeah.
so we'll do either one.
Yeah,
So
yeah.
extension or flexion right there.
Yeah.
So we're gonna correct that and see if we can correct that shape of the spine there.
Yeah.
Okay. So how's it feel? So here we're doing.
She
different
didn't
things
appreciate
with it.
my feedback.
So here's the stretch.
Oh yeah.
And there's the contraction. And so
Oh,
we're
yeah.
trying to get them to work. So
Yep.
we're stretching them and contracting them.
That right there is pure gold, folks.
So get right on
They
that.
do not teach you to do that anywhere else. That is how you get a multifidi to work again.
So you're going to want to get right on that one and practice getting this one to be in the right position here. So get right on that one, yeah. Okay,
Yeah.
so let's take a look at the other side.
Yes. Yeah. You got more sympathy hearts. More sympathy.
You did a good job of getting them.
You're doing great, huh?
Okay, so we'll keep working on those. So let's start about right here. So we'll do the C2 here. So we can do it just on a little bit on the stretch. So we can go ahead and start on the stretch.
Mm-hmm.
And we'll so we find the spine of the scapula. Then the
The
spine of the spine. I meant the spine of the spine. Find the spine of the spine.
Spinous process.
And find the spinous process of the spine and go just lateral to it. Find the spine, come just lateral to it. So we're doing it on the stretch. Find the spine, come just lateral to it. Find the spine, come just lateral, like that. Keep going. Then we'll take it through full range. Let's see what you're doing over here. Okay, so again, here we're feeling here. So again, we want to, so here's the stretch. Okay, whoa, it doesn't like the stretch. And then here's the contraction. Okay, so there's the stretch right there. Let's go ahead. Let's go, let's find the spine of the spine. And then we're gonna go there. We're gonna go, they're gonna contract it and stretch it.
It's something else, isn't it?
Camille?
It feels great to
Doesn't
me.
it feel great?
Find the
love
spine,
it.
Man.
find the
Yeah.
spine of the scapula. I mean, the spine of the
spine
spine.
of the
Okay, and then here we go, right on there. There we go. Yeah, right on there. Okay. Let's see if we did any improvement in getting our the supersensitive spinal segments. Yeah, yeah. Okay, did you do both this other side first?
did that
Okay,
side
let's check it. Let's check.
Okay,
See if we
let's
did
check.
good.
Okay.
Okay, see if it helps.
Okay, so for this, remember you want to have your torso such that your this feels as soft as it could feel. Oh, it feels softer. Okay, so it's lifting up. Look it, it's lifting up. So it's feeling a little softer. This part right here,
Mm-hmm.
T1,
Still.
kind of doing pretty, still a bit tight there. So we'd have to change this a little bit more.
Right.
So what we want to do is train you to feel this soft. So like what you want to do is like you want to come back here and feel flat. You're going, how can I put my head in such a position that this feels flatter and everything feels softer? This feels soft, the side feels soft, and the back feels soft.
Mm-hmm.
So you just, over time, it could take time, but what you want to do is keep getting the head balanced so that it doesn't create this tension right here. There might be other things you're doing too, but besides just standing, but
Right.
something you're doing when you're working or something. Or something else. Or something.
And
Computer work.
when
Sleeping.
when
Sleeping
something
could do it, yeah.
when something is as bad as this is for as long as it's been, this is why you as a therapist come in and you can do what the patient would have trouble doing themselves, but you work through that really tough spot, and then their self-care can take care of the rest.
Yeah.
So it's,
So let's see if we did it. If we improved it on you. Okay. So here, let's go ahead. For this we want this part of your chest to be this way, okay, and then relax. But you want everything to be, you want it all relaxed. So you want this all, so head for head balancing. You don't want anything tight. So you want this to be like so effortless. You want the head to be like it feels. Oh, my neck feels so fantastic. Okay, so here, look at. Okay, but don't lean back. Yeah. Okay, there. So you're getting loose. It's good. It's good. It's good. It's good. It's good. Okay. So good. Good. Okay, so just right here, just the one spot. Yeah. So just right there is the tightest, but even that's coming up. Okay.
hi, Karina and Tuli.
So here, I'll see if I'll go just a little bit on this.
Yeah. So
I'll see if I can correct it.
as the therapist, you can really help them. You're still empowering them, but you're taking the edge off some of the harder stuff that they would have trouble working on their own.
Mm-hmm.
Yep.
Okay, good. So now what I noticed for you is like when you touch this, now can you feel it feels softer? Yes. So what you're looking for is, does this feel softer? And at the same time, you want the side of the neck to feel soft and the front of the neck to feel soft. So you want to keep feeling how the neck, like how the head is wandering back and how it feels nice and soft. Yeah. Great. Okay. That's underneath the trapezius. So we're going to treat the rhomboids, and they cause pain through the between the shoulder blades right there. So we're going to do that a couple different ways. We're going to warm it up. So we're going to use one of our tiger tails.
Warm it up with a tiger tail.
Tiger tail.
Oh boy,
So-
I can't wait to see this.
So this, you're going to hold one hand here.
Okay.
Have it here. And then go ahead like this and really give your rhomboids your trapezius, rhomboids, the leader, everything a nice treatment there like that.
Now, if they
Then
didn't have
together.
If they didn't have a tiger tail, they could use a rolling pin, right?
Well, you wouldn't be long enough. We can
Oh,
do something
yeah, I
else for
suppose.
the rolling pin. So again, you can take it on this side, then you can take it this way.
Mm-hmm.
You're gonna come like this. How you doing, Stephanie?
Yes.
Okay, so another way we're going to do it is we're going to use a pinky ball.
Okay,
Pinky
everybody
ball.
can get hold of one of these.
Yeah, and you get those at a lot of the dollar
Five
stores.
dimes,
Mm-hmm.
things like
So we're going to
that.
go from the shoulder blade to the spine. And we're going to go long and look around for trigger points. We're going to go from right by the shoulder blade where the rhomboid is attached. Then come this way and to the spine.
Tennis
Look
balls
for-
are good, but they can be slippery.
What's bad about them is they can be a little slippery, as you said.
Yeah, yeah.
So this is more sticky.
It's a little
And
sticky.
this is the pink paint eraser here, and we get right onto the rhomboid there. So let's go to the base of the shoulder blade. Go right on that, and let's go ahead and feel the bottom part of it is attached onto the shoulder blade, and then come this way. Can you see us pretty good?
Oh yeah,
Krista?
pinky ball feels really good.
Okay, so let's go ahead and let's look at the other side. So we're going from the top of the shoulder blade here to the bottom. We're going between the shoulder blade and the spine, the shoulder blade and the spine, like that. So we got our other models over here doing it.
Okay, good.
So let's go from the spine to the shoulder blade. So let's go all the way to the shoulder blade, and then to the spine, and then to the shoulder, then drop it down. So take your body away from the wall for a minute, just a little bit, and then it drops down. Yeah, good. And you're gonna go from the spine to the shoulder.
She's doing this side. Okay, sorry.
Let's see how you're doing, Stephanie. So you're gonna come this way from the spine to, so the bottom of the shoulder blade here to the spine, like that. So let's go right there, and let's feel it, and really go there to the spine. Look for tight spots. If you find a tight spot, you're gonna hold it, breathe, and relax.
This pinky ball can definitely be found at, where do we get them?
Well,
at?
I've been getting them at 5 and down, or
No,
5 and,
5 below.
5 below. That's it. 5 below. 5 below.
High bounce. High bounce pinky ball.
Then I've been getting them at also at Family Dollar stores and different kind of dollar stores.
Yeah.
And
Yeah, Dollar
you can
General.
buy them from OPTP for $3 a ball, or from a dollar store for $1. Yeah.
And Pressure Positive does sell
They have a nice ball.
a really nice big black ball, but it's
Oh,
probably
oh.
more around
Oh.
$20 or something.
Oh, well, it's a different. Yeah, but
Yeah,
this
but this one works really well.
dynamics, just that. Yeah. Okay, so we did a good job in the rhomboids. So let's go ahead and really contract those rhomboids, and let's stretch them.
Okay.
And let's really contract those rhomboids and stretch them, and really contract them. Let's do one at a time. Let's go in, and let's take them out, and in, and out, and in, and out. Let's do the other side. And contract it and stretch it. Contract it and stretch it. Okay, next we're going to take a look at the biceps and the triceps. Okay, so for that we're going to use this tool here, and we're going to do it right on the wall. Okay, so here we go. Now this is for the triceps and the biceps. So let's take a look at the biceps first, and we're going to put the tool on the wall, and we're going to roll forward looking for painful spots, and then we're going to roll back and look forward, roll forward looking for painful spots. And once you found it, you're going to hold it there, breathe, and relax.
Would you all be able to move back to a few feet? Cause
Sure.
This way. Yeah, now you're
Okay, good.
Thank you.
Better?
Yes,
Okay,
much
good.
better.
Okay, so here, so we're gonna, now that your trigger points in the bicep tend to be lower down right here. So looking around lower will get your biceps trigger points, right about there. Now if you don't have a tiger tail, let's use a ball. So let's also try a ball. So here is a great tool, this inexpensive ball, somewhere between $1 and $3.
Uh-huh.
We're gonna get right on the biceps, and for this, this is good because you can get right in. So you put the palm of your hand towards the wall, and then you get right onto it like that. Why don't I'll take off my shirt here so we can see it just a little bit better. We take our shirts off for you. Okay, get right onto it. So our biceps trigger points tend to be low. Have you found any tender spots?
Yes.
Camille, how
you
about?
see biceps?
Yes.
You see how biceps? She'll have the arm turned
Oh,
out.
thank you. Okay, good.
See?
So there we go. So
There
we're
we go.
really getting
There we go.
right on the biceps there.
There we go. Yep.
Right on the biceps.
Yep. When she turns her arm in, she gets more to the outside, even almost onto the brachialis, right?
That's right. That's right.
Okay.
So another muscle that can cause some pain, but doesn't go up there to the thoracic, but it causes thumb pain really bad,
Yeah.
and elbow pain. That would be the brachialis. So for the brachialis, we could just put our palm in, and we go straight on the outside. So the brachialis is a great muscle to treat as well. So let's go ahead, let's do the other side. So again, we're going to do the biceps. So let's go ahead and put our palm towards the wall, and let's look for some taut bands. Let's look for some taut bands. Oh, I found a little bit of a taut band right here. I must have been using the telephone too much.
I've never seen you on the telephone, Sharon.
So looking for painful tight spots right in the biceps there. Remember, the biceps trigger points tend to be lower down around through here.
Yes.
That's where they tend to be. Right here.
But where does the pain go up to?
The main pain for biceps is right here in the front of the shoulder,
Mm-hmm.
but it also can cause significant pain here in
Right.
the thoracic area.
Right.
So this is what the reason we're treating that is because it also causes pain there, interestingly enough.
So, you guys really realize that after this class, when someone comes and they say they have pain right here, there's almost no chance you're not going to get it.
That's true. That's
You're
true.
going to get it.
Yes.
And all the muscles that most people wouldn't look at. I mean, everybody knows the traps and everybody knows the rhomboids, but that's one out of, what's our list? List about 8 or 9 long?
Yes, 9.
So-
There are 9 muscles that cause pain in the upper thoracic area.
So most people are missing 7 out of the 9 muscles that cause pain in that area.
That's one reason the pain doesn't go away.
And what's the
sometimes,
big one that everyone's missing except for you guys? Scalenes.
Scalenes.
Scalenes, that's it.
Scalenes.
That's the
Scalenes.
one.
Okay, next we're going to
Okay.
take a look at the triceps.
Okay.
And then we're going to do a nice range of motion exercise for the biceps and the triceps.
Fabulous.
Let's take a look at the triceps. So where is the triceps? So it is attaching here onto your elbow.
Mm-hmm.
And then the part, especially that causes the pain up into the thoracic area, it attaches here onto our scapula, right there.
Mm-hmm.
So this is our triceps. And we did the little test earlier. Remember, we did this test. And
Right.
we did also this test. Okay.
Right.
So we'll want to see if we can get that. So first of all,
Okay.
let's go ahead and let's treat the triceps. So here, we're going to want to get it behind us. So to get the triceps, so if you can hold on to your hand, and if you can get behind us like this, that's how you get your triceps. Now, some people aren't going to be able to get it this way, but this is
Okay.
one good way. So for those of you who can, let's try it. So look at my hand, Stephanie. See, I'm grabbing onto the hand,
Oh,
and I'm getting right onto the back of the triceps there. And I'm trying to get onto the inside of the triceps.
There you go. Good.
Let me assist you.
am I getting it right?
Let's see.
Not
Let's
quite.
see. Let's see. Well, you're getting the triceps, yeah. So you're getting the back. So we want to try to see if we can get this part of the triceps
Okay.
right here,
Okay.
right there.
In there.
So let's see. So what I was doing is holding
Yes. I'm
this
holding-
part
I'm holding.
and then getting.
Can you keep the elbow straight
Uh-huh.
there?
Keep my elbow straight.
If you
Or
can.
Not as
Well, then I
straight.
can't reach my hand, my arm.
Yeah. So she's
I
there's.
can't reach my arm now.
You look really good right
No,
there.
that's
no,
it,
this is
that's
perfect.
it,
You're
that's
doing it
it.
perfectly.
That's it.
You're
Okay,
that's
just
really
sliding
good.
down.
Yeah. Okay, I'll help you.
So the tiger
There you
tail
go.
may not be wide enough for some people.
There, you're doing it really good. You're
That's
right on it. You're right on it there. Yeah. Super. How's Stephanie doing here? Yeah, I like how Stephanie's doing this.
It
She
is
finds some sore
Oh,
spots.
yes.
So we're looking for the painful sore spots. We're pushing those painful chemicals out of the tissue. I like how you're doing that. Let's go ahead and let's try the other arm. So again, the other arm. You get the elbow straight, get it behind you, and then see if you can't angle and get right onto the medial triceps as much as you can. Yeah. Oh, you're doing it really well. Really well. Let's see how you're doing.
Oh,
Yes,
yeah.
yes, you're doing it.
Good.
Yes, you're doing it. This is the part that goes
There you
up.
go. That's the face of someone's
That's
doing it
what
right.
you
That's it.
So let's look at a nice referred pain for the triceps. And
Yeah, the triceps doesn't really cause pain in the back of the shoulder, though. The back
Yes,
of
it does.
Oh, come on.
Okay, here it is. So here it causes pain right here. So just especially the
does.
section that we're on
It
causes
does.
pain right here. I highlighted it for us.
It does.
It also causes elbow, but it causes pain all up in the upper thoracic. And here it is,
Wow.
right here. It attaches right here
So
onto the
that's called the long head of the triceps,
that's
right?
correct, the long head. So the long head of the triceps causes this referred pain into the upper back. Okay.
Sharon, do you ever can I share something?
Yes.
For long head of triceps, do you ever do?
Oh, we're good. Just gonna do that next.
Oh, you were just gonna do that next?
That's
Okay,
it.
I didn't want you to miss
Okay,
that.
all right,
For the origin,
Justin.
for the insertion part, where it inserts it doesn't insert onto the
you were-
all the short heads of the triceps. They end up here on the arm.
Sorry, you
Do
handed
it
it to me.
again. The
You
camera
handed
was
it to me,
backwards.
and it was facing the other direction.
Oh, it was? Oh,
Yeah.
okay.
You
So,
do it again so we could.
Go ahead, do it
so,
again.
so the most of the triceps they end on the arm here, but the long head of the triceps comes right up and attaches in the scapula right there, and so.
We'll be putting it on the stretch.
Yeah, put it on the stretch
So
like
put it
this.
on the stretch at the same time
so,
while
so
you're doing
just
it.
like
Mhm.
just like the test, the range of
Uh-huh.
motion test.
Yep, put it right
And
there.
then you get right in there.
That's it.
Yeah.
Perfect. Okay.
That spot is an amazing spot for so many people.
Yep. So we're getting right on it.
Mhm.
Yeah. And then we can come a little higher. A little
Yep.
higher. Mhm.
Yep. There we go.
Good. And how are you doing over here? Great. How's it feel?
Or,
Do you like using the tiger tail?
yeah, it's
Yeah.
very fun.
Tiger tail's fun. Okay, so could you take one more
I'd love to.
picture? So again, you could also use a ball in case you don't have it tight to the position of the stretch, and you get right onto that area.
Mm-hmm.
Mm-hmm. And you can go right where it attaches onto the scapula.
Yep, there's that long head right there. Don't underestimate that point. It seems to be, you know how muscles have reciprocal inhibition, so when you contract your biceps, your tricep turns off. That spot of the triceps especially responds to biceps.
I'm switching with you.
So
So let's take a look at the other side. So again, we can start right where it attaches there. We're going to go ahead and feel the attachment right onto the scapula. Let's come up a little higher. Get right. Look for a painful spot. Press on it. Come up a little bit more.
if you're really good when you're doing these exercises, you can focus on quality of your foot posture and quality of your abdomen. You can, breathe properly with 3-part breathing instead of, while you're doing self-care, you can add all those other things you can do. Practice good breathing, practice good foot posture, all sorts of stuff. So you look like a pro while you're doing your self-care.
Okay, next then we're going to do our range of motion exercises. Yes?
Mhm.
Ready? Okay. So we're going to shorten the biceps and we're going to lengthen it.
Okay.
And at the same time we're going to contract. So here we're going to stretch and contract. And stretch and contract. Then let's do the other side. And stretch and contract. So we're doing the biceps and the triceps.
Okay.
Great. Wonderful.
Nice smooth motion the entire time.
Nice. Beautiful.
Imagine that you're in control of each degree of range of motion. There we go.
Nice. Very good. How you doing? Very good.
Good.
Excellent. Okay. All right. So next we're going to just take a look at our splenius cervicis. So let's go ahead and take your ball again. And
How many more muscles do we have?
One.
This is the last one?
This is it.
Okay. Splenius cervicis.
Yeah,
Oh, I can never
that's it.
remember these. There's
Picture,
there's the
picture
capitis. There's the cervicis.
Yes, there's so many of them.
Oh my gosh.
Okay. So who can find it faster? There it is. There it is.
Well, I remember the cervicis
Yes.
like attaches onto the neck, and the capitis attaches onto the head.
That's
So,
right. That's right.
That's amazing.
Okay, so here,
Okay.
so here it's attaching here on the transverse processes here, of 2, 3, 4 there, and then it's coming down here.
So it's
and
kind of
attaching.
like the levator scapula. It
Little
attaches
bit,
onto the.
yeah, but it's a little bit more
transverse process.
a little more little different angle of attachment.
Mm-hmm.
And then down here, it attaches onto the spinous processes. So you can see it's attaching there at 3, 4, 5, and 6.
Mm-hmm.
So it's really very much right along the spine,
Okay.
right here. So we're going to start with just this lower section here first.
What does it do?
It rotates. It's the main head rotator.
Is it really the
Yeah.
main head
Yeah,
rotator?
it is. It is.
Seems like.
It's so little. How could it do the main head rotating? But it does that along with trapezius and with the levator scapula.
And that's
So, they're all doing Franken neck there. So we're gonna turn. So we're gonna turn. Go like about to see T6. We're gonna turn our head, and we're
Yep.
just gonna come like this and really feel the spine. Come right next to the spine. We're gonna go right on to look for top bands and painful spots right on that splenius surfaces, and really turn and tip the head down to the opposite side. And let's do it on the other side. So go down around T6. On the other side, turn your head, really turn it, and then really get right next to the spine. Right next to, we're going to go right there. Get right onto it. Now really rotate the head. So when you're on that, yeah, perfect, perfect. Really rotate the head there. Yeah, really, yeah,
good.
perfect, perfect, perfect. Yeah, really rotate that. So that's your splenius cervicis. And then you're going to take your our tool, and we'll take our back knobber tool or our fingers, and we can keep coming up and coming all the way up to the transverse processes right here. So we don't have our little tool here, so we'll have to.
Can we go get it?
We'll go get it. Yeah. So this Franken, so the three muscles that really turn the head would be your trapezius, your levator, and also your splenius cervicis. This one here, they're their main three, and that's the.
How about the SCM also, or?
Well, it's not nearly as much, but yes, it also does. Okay, so here we're going to come here, and we're going to get right next to the spine. So find the spine, come just to the side of it. We're going to press right in there. Well, we'll show it on you.
Okay. Yeah, show it on her. Her hair is
Okay,
out of the
we
way.
got her hair out of the way. So here we're gonna T1, 2, 3, 4, 5, 6 down to here. So we came here, we treated here with the ball. Now we're starting here with the tool, and we're just gonna go right like this all the way to the side of the spine. Right there.
Yeah.
So here, like this, over to here. Right to there, and we're stretching it while we're doing it. Over to here. Okay, you could continue. If you back your tool here, so we did that part already. So we're just going to come like about right here, and then like right here,
And
then right here.
you could use both hands if you want to help
Yes,
stabilize.
a lot of times.
Or reach around from the back
Yeah,
with the left
I
hand.
often do it this way.
Yeah, exactly.
Two
like
hands
that.
like that, and really stretch it and get it.
Then you
right.
can kind of let your elbows come forward and use the weight of your arms to help with the compression. Yeah.
Good.
Keep that head
Nice.
rotated to the left too.
Yeah,
there you
that's
go.
it. That's
Good,
it. That
yeah.
gets it. Yeah, and then right there.
Ow.
Camille, how's that look?
Beautiful.
Does that look okay?
Yeah.
It feels wonderful.
So we just cut. We're gonna just kind of come here. Just come. So this is where your transfers over here.
Oh,
There.
I thought we were
So-
just. Oh, where's
Well,
the
it's a
transfer?
splenius. It comes like this. It gets really close, and then it comes
Oh,
over
yeah,
here.
yes, okay.
Right there, like that.
Okay, is that okay?
Yeah, great.
Yeah, right there.
See, it's the reason why I'm always holding the camera.
We don't fix your muscles now.
No, I
Okay.
Oh, we'll get
So-
to the other side?
Yes, go ahead. Let's take a look at the other side. So you're gonna we did this section already with the ball on the wall. Then we're gonna come press right here, right here. And then turn. Yep. You use two hands is very good. Yeah.
Yeah.
And then keep coming over to here. And then right here. Right there. And really, really turn. Yep. And you get a little bit more lateral
Beautiful, guys. Do you ever do this one on the short too? With
Yeah.
the-
Then we want to take them. Then we can take our. So we're gonna shorten it. So we're gonna take it all the way short, and all the way long, and all the way short,
Mhm.
and all the way long, and short.
What muscle is this? It's important on all muscles, but what muscle is it absolutely critical to do this on if you've got Frankenneck?
This one.
Yeah, this one, and the
Splenius.
levator scap
Yeah,
too.
yeah. These two.
These two,
Yeah, they both attach on the same
they would do the
spot.
same thing. You've got to get them all the way. If they can't shorten, then the neck is going to freeze up.
That's right.
So this is the one that treating
They
on the
have to
short
lengthen.
is so important.
It is, and it's like if I have this, if I wake up with Frankenneck, then I get up, I get into the hot water in the shower, and I use my back knobber and my
Yeah.
tools, and I keep treating it till I get it to go away.
Yes.
Yeah. Then I treat it on the long, and then I keep turning it, and then get it to really shorten and really lengthen. So
There's a muscle in the hip that's like that. You have to make sure it shortens all the way too.
what? Okay.
Little
What is
trivia.
that you
What
need?
what muscle doesn't shorten well? When you start to shorten it, it freezes up on you.
I think someone might think of the answer to that.
Yeah, yeah. All right, people. There's a muscle, especially when you're seated. You ever tried to get up after sitting in a car and it feels like your hip is just frozen? What muscle causes that? Iliopsoas.
That's right.
Yes. That one has to.
Iliopsoas.
That has to shorten.
Okay, so we have some underlying perpetuating factors. So
Okay.
what's really important is lack of one is lack of movement.
Okay.
So if we don't take these muscles through movement, then a lot of times then they'll shorten up on us. So another that's real important is for scalenes is paradoxical breathing.
Yes.
So we show them something about paradoxical breathing. Okay, so paradoxical breathing. So you're going to check yourself standing and seated. So you're going to put one hand on your tummy, and you're going to put one hand on your neck. Okay, so let's put maybe on the other side. Okay, you're good. Okay, one hand on the tummy. So you're going to inhale and have your tummy go out. But watch there. So see how her shoulders and neck just went up.
Mm-hmm.
Justin, can you look at that? So go ahead, inhale. So that's the wrong way to do it. Okay. So what you want to do is this part stays relaxed and the stomach works. So that
Okay.
so we're going to do it the correct way. So inhale, tummy goes out. Exhale, tummy goes in. Inhale, tummy goes out. Exhale, tummy goes in. Next, we're going to do it laying down. So it's nice to maybe spend 2 to 5 minutes doing it standing up. So let's do it laying down. You can do it with yourself laying down on the hot water bottles. So go ahead and lay down on your back. You can put one hand on your stomach and one hand on your neck. So it's comfortable there. And you could just feel yourself so you can see. So you want the tummy hand to go up and down, but you don't want the shoulder hand to move.
Okay.
So you want to have the tummy hand come up and down, but the shoulder hand shouldn't be moving. Yeah.
So, again, the brilliant man who invented applied kinesiology used to ask this question. After he'd fix something, he'd demonstrate something for a room full of doctors, he'd say, now how long does that last?
Stand on one foot, stand on the other
He
foot,
used to
jump up and down.
breathe, chew.
Breathe.
Because if every time you breathe, you are contracting auxiliary muscles that are only supposed to be used in heavy breathing, then how long is your treatment going to last for that patient?
Now, what if you hold your tummy in really hard? You're going to hold your
Oh.
tummy in really hard.
Well, that's how you look good.
And then you look good, right?
Yeah,
but
you look all
then
macho.
when you breathe, you go.
Well, you don't look quite as macho.
then-
What's the point here?
What are we trying to do?
So when you hold the stomach in, it's not going to let your neck and shoulders breathe right. So
Yes.
They,
what you
they
want to do
hurt
is
when you do that.
that's right. So you want to breathe in such a way as you can make sure that the shoulders don't go up and down every time you're breathing, and don't tighten up as you're breathing.
Yeah.
So that's one of our major underlying perpetuating factors. So you could practice it doing laying down.
Great.
Another way we could practice this is sitting down.
Okay.
Okay.
So here, now one of the things I particularly like you to have is a really good lumbar support, and I'd like you to have that just below your shoulder blades when you're sitting down. And so this is an underlying perpetuating factor. So when you sit down, a lot of times people go like this,
Oh yeah.
and this would be common, you know. So what you want to do is put this here behind and get your butt back, and then now your head is in the right position, and there's no Dowser's hump. There's no hump there. It's all gone. The hump is gone. But if I take this away and I sit like this, then there's a big hump there. So you want to make sure. Okay, so you want to correct that, and then you want to breathe. So you can put one hand on your tummy, one on your neck in the seated position, and inhale, tummy goes out. Exhale, tummy goes in. Inhale, tummy goes out. Exhale, tummy goes in. And now, so if we practice that throughout the, like even 5 minutes or 2 minutes on the seated, 2 minutes on the laying down, 2 minutes on the standing, after a while it just becomes second nature, and you begin to do it without. Okay, let's feel it. Go inhale, tummy out. Okay, so this is, you can see that right here you're tightening up the neck. So once you try not to work too hard at it. Okay, so inhale, tummy out, but try to do it in a way that you don't lift your neck. You don't lift
My arm's not that long, so I'm
yeah,
making
yeah,
it
yeah.
shorter then.
Perfect.
That's
perfect.
the key.
Perfect.
I
there.
could drop
Okay.
my shoulder.
Perfect. You did perfect. Okay. So don't lift this part. Yeah. And you're just gonna, but again, just do it more relaxed, like breathing and relaxing. Yeah. Breathing and relaxing. Yeah. So this part doesn't move. This is maybe the most important perpetuating factor in scalenes.
So if you have shorter arms, you don't want to put your arm all the way. Then you want to put it closer.
You just don't want this.
Your shoulder can
you don't
drop.
want the you just don't want this. You want this part not to lift.
Right.
So if you had it here, that's fine. It's perfect. Oh, you're doing it really well. I think you're gonna fix this neck. I think you're gonna fix this neck. Yes. And remember, scalenes is one of the most important ones that was been bothering you.
Right.
And this is one of the critical things in scalenes.
Switch hands.
Sure.
Camille, have you ever worked on paradoxical breathing before?
Yes.
Okay. Good.
You're doing it really well right this minute. You're doing it nicely, yeah. So just try to do the breathing
Breathe
small enough that you don't tighten your neck. You know, so don't make it. It's not a deep breath, so you don't have to take deep breath. Just a relaxed breath that doesn't make you tighten your neck up. Good, really good. Oh my gosh, outstanding. Okay, how are you doing, Stephanie, with your breathing?
We've got a breather.
Now, I've learned to do this pretty well almost all the time. I almost never breathe using my neck, you know, so I've trained myself to not do it. Whereas I most likely, probably I used to do it. Most likely.
Good.
So, what is something that's really important, Justin, like, what do we call it? Like Sharon's, what we call it? Sharon's
Silver bullet.
Sharon's
silver bullet.
Sharon's silver bullet. Okay, so you guys keep breathing and doing your practice.
Yeah, nobody stop breathing.
Don't stop breathing.
I tell my clients if they stop breathing, I stop working.
Okay, so the one thing
Got
I
lots
like.
of hearts for that one.
Okay.
Hearts for that? Oh,
Well,
cool.
you gotta do that. So the thing is a lot of people, even who I was treating, even I'll see them when they're walking around and they'll have their arms bent like this. They'll hold their hands like this.
Like
so
surgeons.
my main thing is for getting rid of upper thoracic pain, is unbend the arms. So you have to make sure that you unbend them. So that even you're walking around, you always got your arms bent like this. Your telephone, you're working on your computer, you're treating people, you're cooking, you're driving the car. Everything is arm bent. So the first thing you want to do is unbend the arm. So I get your arm behind like this. So one hand holds the other like that. That's good. Or just, I walk around like this. Just one, just take the arm and put it behind like that. So instead of having the arm forward like this. Okay, so what's another problem that we can have? Sleeping. Okay, so show how sometimes people sleep. What do? Okay, so they often are putting their hand underneath their head. This would be common, right? They're always putting their hand, and then they get they get like their arms like all over their head. And then another thing they do is they bend at the hips really hard, like this. So what we want to do is unbend while we're sleeping too. So we want to unbend the knees, unbend the hips, but it doesn't have to be straight.
Yeah, not completely straight because
'cause we don't-
that's shortening the opposite muscle.
Excellent point.
That's why I get paid
Okay.
the big bucks.
Okay, and so for helping her to have her arms unbent, so we'll have to use some pillows.
Yes.
Mhm.
Oh, you know where some pillows are?
I thought you were going to use the cushions. Yeah, real
Mhm.
pillows.
A real pillow.
Oh,
yeah.
okay. I don't know what
So,
those are.
okay. So here, let's have you come up. So you want to have your neck really supported well, and you could come like this, and but your arms, you don't want to have it up here or here, so you have to have your arms in such a way. So one way we can do it is put your arm behind you. So often I'll put a pillow behind you right here, and have your arm rest on it.
Yeah.
So that would be a good way. Now, a lot of people have put a pillow in front of them,
Mm-hmm.
and then that shortens up the bicep right here.
And the
because
pecs, too.
And the pecs, but the bicep also attaches
Mm-hmm.
right here. So by having it behind you like this,
Mm-hmm.
you're stretching it. So I put a pillow right here to hold your arm behind you like that. Well, those aren't big enough, but let's try it anyway.
Give me a couple of these.
You need 10 of these.
10 of them?
Yeah, keep
Oh.
coming.
Okay.
So if you had a pillow,
Yeah.
and then you put your arm right on it like that.
Oh, you have one of these.
Mhm.
You have both
Like
on
that.
that side.
Yeah.
You wanna
So this
grab
would be
that?
no. Have we got enough
Down
time?
it?
Yeah, we're
Mhm.
Yeah, no. Okay.
So this is so you put a pillow here, and then you come like that, and then you make sure that this one is a little bit straight. And sometimes you might use a little something to put under it, so it doesn't have to be all the way straight. Yeah. Okay, so this would be a terrific way to unbend the arms. So you could definitely unbend them this way. How's it feel, Stephanie?
Okay.
I could tuck you in at night.
Yeah.
Okay, this is a McKinsey roll, and you could put this one, of course, as well. So this could be good for some people. This is a nice, you can get that right under the neck.
Yes.
hmm So this is a really important underlying perpetuating factor.
Those of you who
is
have kids,
constant bending of the arms.
yeah, those of you who have kids, it's a good idea to help them learn how to sleep, develop good sleeping posture habits.
Yeah, you
You
can
know,
tuck
from
them
young.
in.
Tuck them in. Show them how to get nice and comfy. When you start using pillows to bolster, they start to like it. They're like, oh, tuck me in, just in that perfect, you know.
All the patients want to know if I can
Thank
come to
you.
their house and tuck them in at night.
We were given the
Camille likes
5-minute
that.
warning. Oh, no. Oh, yeah.
Okay, so another underlying perpetuating factor that's real important is lack of movement. So we're going to again do movement to music.
Great.
So we'll do that one more time. So we'll put a little bit of music on.
Yes, please. Thank you, soft spoken.
Okay, I'll have to be louder. Okay, let's have you go ahead and sit up and throw your feet over the side. Both feet.
Anybody remember what the real huge added benefit of movement is, especially end range movement? Neuroplasticity of your brain, keeping the brain young and healthy and flexible, is done by end range motion. So not the moving your arm back and forth during the 60 to 80% of normal movement, but that extra 10 to 20% of end range movement really activates the brain.
Here we go. You're going to give it to us?
Yeah.
Okay, here it comes. So we're going to do all the movements that we were doing before, all the range of motion tests. We're going to do them with music, and remember that if you always hold your head straight forward, none of the muscles learn to have their full range. So you got to be able to really look over your shoulder. Okay. Okay, you got it. Great. A little louder. Good. Okay, so trapezius, so up and down, and down. That's a little bit too loud now. Okay, and up and down, and back, and down, and up, and down, and further back, and down, up, and down, and really back, and down, up, and down, and really back, and down, and forward, and back, and forward, and back, forward, and back, forward, and back, forward, and back, ear to the shoulder, and middle, ear to the shoulder, and middle, ear, middle, ear, middle, ear, middle, ear, middle, and rotate, middle, rotate, and middle, and rotate, and middle, and rotate, and middle, and look up, and middle, and down, and middle. Can you pass those range of motion tests? Can you get your nose up? Can you get your chin to your chest? Nose up to the ceiling, chin to your chest, and up. Okay, now we're gonna go down, middle, back at an angle. Down, middle, back at an angle. Again, down, middle, back at an angle. Other side. Down, middle, back at an angle. Down, middle, mid. Good. Okay, so let's go ahead and rotate and come on back and all the way back. And come again, forward and back. Okay, so we're going to do our triceps and our biceps. So let's do one at a time. Let's go ahead and stretch it and contract it. And stretch it and contract it. And stretch and contract. Other side, and stretch and contract. So what's good about having music? Makes it more fun.
Right.
More fun.
And you might kind of stay with it longer because it's the simple movements. And rotate in again, and thumbs out. Rotate in
Yeah.
and out. And one arm at a time, so put one arm behind you. Rotate in, take it out.
That's right. Rhythm. It's very good.
In, and out. And in. And out. Other side. And in. And out. And in. And out. And let's clap over our heads. Clap. And down. And clap. And down. And clap. And down. And clap. And get them right next to your ear. And down. Good. Okay. Okay, what do you think?
Also makes you good at the hokey pokey.
Push your take it out. Put it in. Take it out.
Shake it all about.
That's
Put your
right.
triceps in.
That's right.
Put your biceps out.
That's right.